I'm going to be showing you how to do a back slab for a forearm, used for soft tissue injuries and for immobilising anyone who's had a wrist fracture that needs to be rested and splintered. So the equipment is right here on the table. We use a Velband, which is basically cotton, as a padding. I cut a hole in it to fit the thumb so it doesn't slide off the hand. We have a back slab that I cut out with a little insert to wrap around the thumb and some bandages to wrap around at the very end. So, well, I'm going to put this around your thumb just so it's anchored down and it doesn't go anywhere, and then gently wrap around the rest of your wrist and all the way down to the forearm. You should still not have wrinkles in it because it can cause pressure areas under the bandage. So you wrap it around, usually with about a third to a half of overlap. If there's any gaps there, put a patch of this stuff over the top just to cover up the holes, and make sure there's enough padding around the thumb. Now, as I said, I've cut this to have a little space for the thumb so you can wrap it around at the end and it's not so uncomfortable. And then we need our water. When you dip this stuff in the water, it should be reasonably wet. So don't make it too dry, and otherwise it will be stiff and hard to maneuver. Dip it in, give it a slight squeeze. You can also smooth it out to make it flat. And then this comes the fun bit. So you apply it to the wrist. I've measured this beforehand, so that's how I know it's going to fit, Narelle. And then you put that space available for the thumb facing the thumb joint. If you lay it on nice and flat with the palm facing upwards, it's very easy for the patient to sit there while you do this. It's reasonably comfortable. Then you use your crepe bandage to wrap it around. Now, I like to do a little bit of a figure of 8 wrapping, where you try and get it on with a little bit of compression. Sometimes in the acute setting when the arm is injured and it's painful, this is hard to do, so sometimes it's best just to wrap it on and then let it settle down. Feeling okay?
Yes.
Good. And the bandage always ends up on the underside of the arm. It's like Murphy's Law. And sticky tape. So a couple of pieces of tape to hold it there. Lovely. Wonderful. And then I normally tuck in the edges of the bandage just so it's not rough, it's not causing any rubbing. Also at the top of the palm bit. And then make sure that there's no edge that you can see that's plaster. And the next thing to do is to take by the elbow support, put the elbow on the table, and then gently make the wrist into a slightly extended position. This is called the position of safety. Obviously, if there's a fracture here, you wouldn't be pressing right on the fracture, but this is just to give some moulding and to let the cast sit in a neutral position, just like that. Let it set. Tell the patient that this is actually not a waterproof cast and the bandage certainly gets wet, so it needs to be kept dry at all times. Thank you very much.